Dr. Sudha Krishnamurthy is the Director of Postdoctoral and Graduate Student Affairs at Gladstone Institutes, San Francisco. She has over 8 years of experience advising early career scientists on career development, professional skills, and on diversifying in the scientific workforce. She is an accomplished biomedical researcher with interests in cancer biology, dentistry, and higher education. She advocates for policies related to postdocs and graduate students, students of color, and international trainees, and works closely with the National Postdoctoral Association and the Graduate Career Consortium. She is also an assistant adjunct professor at the School of Dentistry UCSF and periodically serves on NSF panel reviews and advisory committees related to postdoctoral training and career education, science outreach, and mentoring programs. Longitudinal career outcomes, the development of a postdoctoral curriculum, experiential training, mentorship, grantsmanship, writing, leadership and management, and postdoctoral diversity fellowship programs have been some of our recent projects. Sudha is trained as a dentist scientist with a PhD in cancer stem cell biology from the University of Michigan and a postdoctoral training from UT MD Anderson Cancer Center.
Very good evening to everybody. Welcome to another episode of Eclectica, the Different News. Well, I have a very interesting and gorgeous guest with me today, Dr. Sudha Krishnamurthy. She is the Director of the Postdoctoral and Graduate Student Education and Research Development, Gladstone Institutes, USA. So without further ado, I will call in my guest here and we will have a fantastic conversation today where Dr. Sudha will tell us that how she led her passion into her profession, and basically our topic is very interesting. It is something like teeth to train, follow your passion. So here I welcome my guest and we will have a fantastic chat. So stay tuned with us. Hi, Dr. Sudha. Thank you so much for accepting my invitation to Eclectica, and I'm so happy to have you here as my guest.
Thank you so much, Dr. Gargi. Thank you for the invitation. I'm really excited to have a conversation with you and to share my journey with all our viewers.
So, Dr. Sudha, actually, it's very interesting to see what you do and being your education. I mean, if we go back long years back, then you were trained as a dentist, but then today you are the Director of Postdoctoral and Graduate Student Education and Research and Development. Can you tell us your journey? Because that is something I think that it will inspire a lot of young people, and even I will get a lot of shots of inspiration. So please.
Thank you so much, Dr. Gargi. So my journey is what we would not call not a linear path. So I started with, even as a child, was very, very interested in healthcare. So I always imagined that I would go into medical school or dental school. And as I finished my, my high school education, I ended up in dentistry in Chennai, in Ragas Dental College, which is a part of Dr. MGR Medical University. I really enjoyed my time as a dentist. I loved working on patients directly, making that real impact that you see. You know, a patient comes in with with a toothache, and you actually treat it, and when they get better, the real immediate impact that you see, that always stood with me. So patient care was something that I really enjoyed. But but life throws you curveballs, and one such instant was in my final year when we are in oral medicine rotations. So when I was actually seeing in the clinic, I met a patient who had come for routine dental issues, a toothache. And when I examined him, and we do a whole full mouth examination, even if they are not for that come for the whole reason, I found a lesion which I suspected could be precancerous or cancerous. So I obviously, this was at Ragas Dental Hospital. It was a situation where they were not from a very good social economics community. So they just wanted the toothache to go, and that's all they wanted. They didn't want to have further testing. But I had to educate him and his wife. And we went in and we did a biopsy on the lesion, and then we transferred it to oral surgery. And it was truly a cancerous lesion. So it was a young adult. He was a smoker, so he did have pre-existing conditions in this. Risk conditions, but he was healthy otherwise. But he already had nodal, lymph node metastasis already. So the prognosis wasn't all that great for that individual. So that kind of changed me as a dentist. So I got interested in knowing more about, yes, we were able to treat, we were able to do all those elements, but what could we do to prevent this disease progression was something that really lurked in my interest. So I decided to go in and follow my interest in pursuing research, and that's how my research journey started. So after my clinical degree in India, I decided to apply for PhD programs in cancer biology, and I came to the US. And I ended up in University of Michigan School of Dentistry. So I started my PhD program in oral health sciences, with a specific emphasis on cancer biology. So I loved it. So, I'm very, very fortunate that, I've actually taken almost 3 different tracks of careers in my life, and I've enjoyed them all. And I've actually really cherished the time that I've done all 3 of them. So I loved doing my research. I did my PhD, and then I did my postdoctoral training. I went from Michigan to in Texas, University of Texas, MD Anderson Cancer Center. So it's one of the world's most famous cancer centers for my postdoctoral training. And I continued my studies in cancer biology. So during my PhD, I was able to study a molecular pathway that really excited me. I worked on primary cancer cells. So I actually worked with the surgery departments, getting actually cancer tissue, studying them and doing analysis on them and looking for molecular targets. So we published it. One of the molecules that we studied is actually in clinical trials now. So in that way, it was a very, very satisfying research career. But during my PhD and in my postdoc, I was very, very active in the student and my postdoc community as an individual who worked on putting together professional development workshops, career development workshops. It was something that I was very passionate about. And when I finished my postdoc, it was interesting because the postdoc office there noticed, the manager there actually realized that I'm very passionate about other people's skills and strengths, even when they did not themselves. So she suggested that, yes, I was considering moving into a faculty career after my postdoc, but I wanted to take a pause and say, what does it really matter to me? Where do my real interests lie? I loved doing my research, but what do I do next? And she suggested that, people has been a common factor for me. And I think in all the 3 careers, that's my commonality, that I've enjoyed making a difference in other people's lives in some form. And due to that, I decided I will explore understanding and helping people realize their strengths and helping them realize their career potential. So with that, when I moved to the West Coast Michigan is in the Midwest. So I moved to the West Coast in California, so where I am, San Francisco area. I ended up joining at Gladstone Institutes, first as a program director now, and then I got promoted now as the director, where I work with PhD students and postdoctoral scholars and helping them, and also to a certain extent junior faculty, helping them realize their strengths in their careers and helping, like I build their education space, I build curriculums, I do admissions for PhD students. So in those aspects, I have a direct impact on education and development of individuals. So that's my journey for the last 10 years or so. But thank you for asking me to share that.
Fantastic. I think it is, it's just not like one track path that we generally see when we come out of college, or we just see our nearby seniors, or probably we ask somebody that what next to do. So I think I personally find your story interesting because, and I think as an individual, right from the student age, you were very, very focused. You knew what you wanted. I think that clarity is something which is which is really mind blowing. And thank you for sharing this journey. It is awesome. I think you have by this time gained so much of skills, that I think there are a lot of places where application still lies. I think this is wonderful, wonderful. So I think with the same pattern, the like kind of passion you got, and the way you try to translate your passion, not just thinking of a conventional way of doing it, like okay, tuck tuck tuck, like this, after BDS then MDS or stuff like that. So with that context, what I see, and probably you will know better than me, that many people struggle to actually find their true passion in life, because most of the people at the end of the day is like, oh, I don't like my job, or I'm not doing something worth it. So what advice would you give to someone who is unsure about their career path, or is probably kind of skeptic or afraid to follow their passion?
No, thank you so much for that question. I I do see a lot of people on their careers on my day-to-day job regularly now, and this is one of the things I tell them: like, you live your life once, so do not compromise on it. It's just like such a basic fact, but that we forget about it, and we measure for success as our success by what others view it instead of our own lines of success. So helping people understand that, I think, is very critical. For me personally, in all the journeys I did and I continue to do, it's like I always see, does this make me happy? Am I feeling fulfilled? Am I having an impact, a positive impact on the people around me? So having those kind of parameters, I think, is very helpful. I completely understand, when there is so-called what a linear path is, right? Like when we go into, especially with dentistry, you go into, and you rightly said that, either you start a clinic or you go into a MDS, or if you do an MDS, you start a clinic after that. Maybe you teach at a hospital with, associated with it. There's nothing wrong about it. There are a lot of people who do wonderfully well, and a lot of power to it. I just realized that was not the path for me. And
Right.
it's important for you to have that understanding of yourself. It's a self-awareness thing. I realize that I am a person who constantly likes to be questioned, pushed, challenged. Monotony is not my thing, so I really like differences on my everyday routine. And for that, I knew that path would not be the best for me. And it's important, I think, for people to understand, to keep an open mind. Don't let, just because you know one path doesn't mean that that's the only path that makes sense. I think that's the most important advice that I used to get from my parents, is to be just open, be engaged, be curious about things. So then your real passion comes to you. So when you come across and you think, don't be afraid to ask questions, don't be afraid to try it out. And there's nothing wrong by saying you tried it and you did not enjoy it. It's totally fine. Your dental career is not going to go away. I still can go back to India and practice. It's aware, and I think that helps, especially for people with a clinical degree, is that your training is never going to go away, or with any uh, education, that background that you have, you're going to have the knowledge. How you apply it is what matters. So taking that risk, I think, is helpful, and you try it and you realize that, no, I really love having practicing dentistry in a clinic. It's perfect. Then you have no regrets in life. So I think that's how I would approach it. And one of the things I learned as I went through schooling and started my dental degree, you're not aware of the choices that your degree can actually have.
Right.
Right? I wasn't told of anything else other than finishing my BDS, either start practicing right away or going to an MDS program. So I wish there were more opportunities that people can get exposed to. And I met somebody when I was in my second year. I actually met a student who had finished his BDS program and was going to the US to do his master's in research. So that was one of the only time I heard, and that intrigued me. I was like, oh, he's doing something different. Like, let me find out what he does. And I actually followed him on LinkedIn to see what he does and where he goes. And, small opportunities like that. It's that little flame that you need. And you need to pursue and see, oh, this is exciting. This is something that you want to know more about. And how do you pursue it? So I think that's what I would suggest to people who are not sure what they want and afraid to make a start.
Fantastic. I think it's a very useful advice and very practical. And I think in today's days, particularly in this era of technology and internet, it's not like our childhood times, So information, anybody can harness information like just with a click. So I think it's a very valuable advice that you have just shared with us. So Dr. Sudha, as a dentist turned to a researcher and an education director, how has your background in dentistry actually influenced your work and your approach towards this training in research and development? Is there any context or it is not there? Probably I would like to learn from you.
That's actually a very, very interesting question, Dr. Gargi. I am a big believer that, your experiences impact you or and influence you in a lot of ways. So I think from my dentistry background, some of the things that I can think that I've directly transferred that I apply on a daily basis is a fact. I think the most basic one for me would be put patients first. Right, in everything you do. It doesn't sound, I mean, we always think of that in clinical care. In research, sometimes that's not as prevalent. But like, for example, people pursue interesting questions in research, but if it doesn't really impact or influence or change the way of modality of treatment, why do you do it, right? So that's one of the biggest poignant features that I think it's impacted me. I'm usually very big picture, big vision. I can step back and immediately say, so what? Why so? Those two are questions which I think dentistry has taught me very significantly. So, and it makes a big impact in how I think. And not only in research, even in my current role as education and research development, I always look from the perspective of the impact, the significance. Why should we be doing this? How will this help? Will it help our future researchers think widely, think broadly, think deeply? So I think it's the same thought process that I think that's transferred from dentistry, which has definitely made a difference. That would be the most important one. Some of the other things that I can think of is dentistry is a very unique field. I don't think people realize that. Yes, it is a form of medical care, but it's also very unique in the fact that dentistry is half science and half art. There's a lot of art in it. There's a lot of creativity in it. There is a job the pride of a job well done when you do a really good filling, be it even a filling or a scaling or whatever we do. So I think that has influenced how I perform my tasks and how I perform my work. And dentistry also prepares you to be an entrepreneur of your own. I mean, people don't see that, but that's the truth, right? How many dentists with a BDS degree go out and start their own clinic, and it's a business. So you start to think that way as well. So in an educational field where I write grants, I raise funds for a lot of initiatives, and I think that business transaction of how do you operate on a small budget but to be effective and maximizing resources is something that I think dentistry taught me more than actually research. So in those ways, I think definitely the background has brought me to where I am.
Fantastic. I think the way you have put your insights to our audience, I think people would really now look into dentistry who are studying or who are aspiring or who are even practicing. They might get some pathways to get some trickling in their neurons to see things a little differently and understand it better, continuing doing whatever they are doing. So that was wonderful. So like we talk about passion, and we hear great people, great men say that follow your passion, but as an entrepreneur myself, so I know that that's a very, very difficult journey to be in a true sense, in a practical sense. So just a question, because you talked about entrepreneurship with dentistry and passion that we are talking about all together, is that in your experience, what role does passion play in achieving success and fulfillment in one's career? I mean, is there any alignment with passion or professional pursuits, or should we keep it separate, or try to always align them? So what is that What would be your take on this?
I think it's very unique for each individual, to be very honest with you.
Hmm.
My personal approach is, if I'm not passionate about something, I just don't do it. The reason is simply that, like, if you love what you do, my dad
Right.
always used to say this: if you love your work, work is never feels like work. And he's been absolutely true. I don't think I ever understood growing up, and he would say
Hmm.
that he would work long hours, and it would never make sense to me why there was. I would always talk to him like, "What work-life balance? Like, why doesn't it exist for you?" And and it would never tire him. And I think it was that, and I think it was his passion for what he did. And when I realized with everything that I've done is I'm right now talking to you at 10:30 on my time, 10:30 p.m. on my time, and
I
this
know.
is absolutely exciting. So I genuinely believe that fulfillment goes a long way if you're passionate about what you do and understanding your values in life. Values is something that I also use in my coaching. I also coach people to help realize their dreams. So in that is, it's very important for people to understand what values are important to them. Like, for
Hmm.
example, values can be, um, you know, a core integrity, but it can be for family, it can be work-life balance, or it could be
Hmm.
whatever that aspect is. If your job is in perfect alignment with that, I think it's very fulfilling, and I think that's where passion is for me. So, dentistry can be a very lucrative career if practiced the right way, right? I mean, I
Hmm.
chose not to do that because this is what makes me fulfilled. So, this is what my passion is, to educate people and help build the next generation. So, it's realizing that makes me feel like, so in that way, I think passion is absolutely essential from my viewpoint to be successful. So, that's my metric of success.
Right. Right. So thank you so much for that answer, and we got a lot of clarity. And probably the students or freshers who would be listening to this conversation, they will now understand how exactly to go about it, or see things in a correct way. Because sometimes we are talented and we are skilled at certain things, and as you rightly said, we don't realize the game. So finding passion and understanding the values is also a very important aspect. And if you don't mind, can you tell us about how you coach people? Like, what is the way and how exactly you take forward, or if somebody wants to take up your coaching services, so how is that? Can you please help us with that information?
Sure. So when I say coach, I mean, it's for coaching for career transitions is primarily what my strengths are. I also do professional development, leadership development. So primarily it's for higher education people. In my domain expertise is life sciences. So I work with individuals who are interested in, say, they're doing their PhD program in X,
Hmm.
Y, and Z, and they're trying to understand what should be their next career strength, and they are having a tough time in realizing that dream. So I
Hmm.
usually work with them one on one and helping them understand what their strengths are. How do they self analyze it and then self reflect and look through opportunities that exist, and how do they make that happen? Be it, writing, applying for the right positions, or how do you identify that position is the right fit for you? How do you interview,
Hmm.
negotiate? This whole career transition pathway is something I do. I also work with individuals through my through Gladstone, where I work on helping them understand, develop leadership skills, mentorship skills. Because one of the
Hmm.
important things is not only will they be researchers of the next generation, but they'll also be the teachers and mentors of the future generations. So it's very
Right.
important to me that they are prepared to take on that additional role. So
Hmm.
those are
Hmm.
the different ways that I mentor and coach. So, but yeah, that's one of my passions, and I think that's how it got started in this education journey for me. That
Hmm.
I would just talk to people, my peers, when I was in my PhD and my postdoc, and I would say, hey, "You're really good at this. Have you considered doing this?" And I heard about this role. So yeah, that's how I coach people.
Fantastic. Thank you so much for sharing that. So, when you pursue a career, any career requires dedication, I understand, but particularly when it comes to research and development, it requires a lot of dedication and commitment, actually. So, what challenges have you faced while along the way doing this, and how did you overcome them?
That's an interesting question. So I think one of the first biggest challenges I experienced was the fact that once I was in dentistry doing my BDS, and then I
Hmm.
wanted to pursue this, I didn't find any role models. I didn't really know a clear path as to how to get to the next step. And I think that's a challenge that a lot of people face is
Hmm.
you realize that you're interested in something, but you don't know how to get there or
Hmm.
or what will that take you? What does it
Hmm.
take to be there? The reality of it. So I think that was a huge challenge. And even when I moved away from active bench research into this education space, again,
Hmm.
it was another time where I needed guidance and I didn't really have that. So finding, because when you take a non-linear path, it's finding those models and finding that support structure is critical because you don't really know what you're doing, right, when you're pursuing something. So I think that was one of the biggest challenges, but it also became one of the biggest strengths because
Hmm.
it made me very perseverant. It made me go out and find my own support network, find my own mentors, find my own people I could talk to, and build my network, which is, I think, extensively important for individuals to thrive in a career. So,
Right.
so sometimes, things that can be a disadvantage can work to your advantage because if you don't help yourself, who will, right? So,
Right.
so that is one. Definitely moving from India to the US, there was a cultural change, being international. So definitely had some immigration journeys for another day that I can share. So those were some of them. But
Hmm.
um, I think the most important would be finding your path. Sometimes you talked a little bit about how clear I am. I was like, no, there are days when I had no clarity. I was like, what am I doing? Am I being crazy? Giving up a really good, rewarding dental career when I could be practicing. I'm trying to
Hmm.
pursue this. And I didn't have much of a research experience in India, where my other PhD students were, they already had 4 or 5 years of research experience. So that definitely imposter syndrome is a huge thing when you break into a new field. So I think that was a big one. And it never goes away. And I think that's important.
Hmm.
I think that's another reason why I do coaching a lot, because there were a lot of people who coached me along the way, asking me to believe in myself and
Right.
keep pursuing. So I think those were the big ones I would say. Um, Find your people, be open, don't be scared to ask for help. Don't think that people will think that, oh my god, this person is crazy. They don't even know this. But because everybody is there at some point in life. So I think those are the lessons that I learned along my way.
Amazing, amazing. The way I think the way you look towards life, it's fantastic. That perspective. I mean, you have always made your challenges or whatever you have faced convert something to a very positive. And as you said, that those struggles today has become your strength because probably since you went through all these experiences, probably today you can mentor or coach other people who are in a similar situation. So I think that is really mind blowing. So, Sudha, what advice would you give to aspiring researchers and educators who are interested in making a difference in their respective fields? So, like how they can motivate themselves, like how you did, how can they motivate themselves to, overcome obstacles, whatever they encountered. So, if I just put it like that.
Hmm. Um, I think the biggest one is believe in yourself. I think it's very, very important, especially if you're going to be a disruptor in a field. You're going to be one of the first few or one of any, um,
Mm.
quote unquote, is you have to be very strong in what your beliefs are. What you say is, I mean, it's the typical thing of what a researcher also does, right? They really have to believe in the research question and in that product or that pathway or whatever they're working on. So being a very strong self is, I think, is really important. Some of the other things I would say is be open. Yes, you need to believe in yourself, but don't think that you know everything. Be open to learning. So growth mindset is extremely important. Uh,
Mm.
when you shift careers or even tangentially when you move into things, um, we have to be humble. And I think people sometimes forget that you are starting at a lower position, in the sense that you're starting with people who have been in that space for a long time. So humility
Right.
goes a long way in learning and being able to do that. It's almost like learning your ABCs in a different language again. You just can't say that, hey, I have a bachelor's degree in English, that I can go back and do this in Telugu or some other language. No, it
Right.
doesn't work that way. So I think some of the things that I
Hmm.
learned and would be useful for people who are pursuing. But don't be afraid. Really, don't be afraid. What's the worst thing that would happen? We would just retrace your steps back. But even that experience will gain you a lot of new skills and strengths that will really come in handy no matter what you do. So in my opinion, failure is really nothing but an opportunity to learn more. So as long as we see that as our approach, it really helps taking that risks with things. So
I think this conversation is becoming very powerful in terms of the advices and guidance that people are getting from you, and I'm also taking up a lot of shots of inspiration, which I was actually looking for, to be very honest.
I
So
was
thank you.
very excited about your career.
Sorry.
I was very excited about how you moved into science. So
Yeah, I mean that's a different story. Probably I would share it backstage because I think this is about your show. So so yeah, so Sudha, like the journey from dentistry to research and education development is quite unique. Like whatever you have shared with us, we all understood that. So how can individuals, according to you, leverage their existing skills
mhm.
so and or expertise to explore new opportunities and, as you rightly said, transitions in the career? Can you give some pointers on this so that it would be helpful for people who are at this stage?
Mm. This is actually a piece of advice I got from someone I really value, and I think
Mm-hmm.
that would be very useful here. And this person was advising me when I just moved into this education space and I was trying to learn how I should grow, what I should do.
Hmm.
She advised me, don't say no to any opportunity. But I actually say that with a little bit of a disclaimer. Don't say no to any opportunity unless it's going to affect you in the negative way.
Right.
So I think that's the fundamental way of learning and leveraging your skills is be curious, ask questions to people. See, every time whatever career you're doing and whatever stage of life you are in, just being aware and being curious of the people around you and the things that exist, and asking the right questions. So that will give you an opportunity to see, oh, that's interesting or not. Say you are in a clinic and you're doing something, but you come across a colleague who read about a paper that they said. Just ask questions. Oh, what was that case about? Let me go and see. Is that interesting? Even if you're not interested in publishing a paper like that or doing something like that, it's knowledge gained. So that's the viewpoint I think is extremely useful and helpful. And it's leveraging your own network, leveraging your own strengths, and access to things that you have. I think that would be my biggest suggestion for people. And not everybody is looking to do a career transition. So just be
Yes.
cognizant of that. And you don't have to. Just because a bunch of us have done multiple careers doesn't mean that you might be in best one that's for you.
Hmm.
But
Hmm.
just being open and being aware will always help you.
Right. Right. So just coming back, because we share a common degree, that is dentistry, though we both of us we do different things rather than only clinical dentistry. So how do you think that the dental professionals can benefit from the individuals who follow their passion outside of traditional dental practice, or probably what unique contributions you think that they can make in the field, in the field of dentistry, probably?
That's a tough one. Um, because we don't see too many dentists, and correct me if I'm wrong, we don't see too many dentists going and doing other careers, right? Like they tend to stay in dental associated field. They might be doing research, or they might be doing it. They might be doing teaching dentistry in a college or practicing dentistry. That's primarily the three areas that I have come across,
Right.
and right. So that's why But I think what is helpful is people not assuming those are the only options you have because you have a dentistry. And I think that's the fundamental thing. It's just as any career is, it is a professional education which helps you set to do one thing, but it also gives you this amazing plethora of skills that get built in you, be it your hand skills in doing things, or your thought process, or your approach to things. We talked a little bit earlier as well that dentistry does involve a lot of different acumen of elements, and depending on where you are and what your opportunities are, exploring them, being open to exploring if needed, is what I would suggest. And if you are considering, there are at least two of us that I know of now who are dentists by training, but who are doing things that are not really dentistry directly.
Yeah.
So that's what I would be. That what I would say, that it's definitely doable, and it does help you, give you a unique perspective to add. Even in a research field, that was one thing I was told, that there are enough dentist trained researchers, or medical trained researchers as well. So what we call as MG PhD in the US and DDS PhD, they have a unique set to contribute in the academic enterprise. So just always remember that we have a perspective that the persons who don't have a dental background might not have. So never be shy to share. So that's what I would say.
Thank you so much. I think we are almost at the concluding part of our conversation, though I really don't want to leave you, but then I think it would be I think we will have more occasions to talk and have more conversations in the future. So this is one question I ask to every of my guests, is that what would be your takeaway message, or giveaway message to aspiring young dentists? Because the question I ask, Sudha, because I see a lot of people who are struggling. They think, particularly, I don't know about the Western world, but in India, it's kind of a wave that flows that dentistry is dying. There are no opportunities, no jobs. So I really, want people to understand that this is not the truth, as you said. So seeing your career, I'm sure that a lot of people got inspired today. So a message from you would be really, really helpful for them to at least understand that, go and explore. So, yeah.
I think I am going to, at the risk of being repeating this, I would say, keep an open mind. Don't be afraid. And be curious. And I think that's one of the things in the Indian education is not very often talked about, is to be curious. For some reason, we all say curiosity killed the cat. I'm like, no. I mean, if we are not curious, how would we ever learn things?
Yes.
So I think that those are the biggest things I would say to the dentist. Don't assume that this is the only thing that you have to do and this is the only way to success. So have an open mind, build your network, talk to people, be curious. So that would be my take-home message.
Thank you so much for your time. I think it's very late there, but still you have given me time for this out of your busy schedule. Wonderful knowing your journey. Thank you so much, Dr. Sudha, for being here once again.
Thank you so much, Dr. Party, for having us. See you. Bye-bye.
Bye-bye.